Thank you for joining us tonight, Jeff, Sonya. I'm really excited to be here to talk about the upcoming Otolaryngology core curriculum with the two of you.
The topics are going to cover, as we said earlier, the breadth and depth of the specialty, and the editorial board was instrumental really in identifying the top 100 topics. We went to OtoSource, which is another program within the Academy portfolio of programs, and I think there are over 200 topics as well as skills in OtoSource, and we basically took that information and we were able to condense it and distill it down to the 100 topics.
The editorial board did such a great job really thoughtfully curating and distilling all of otolaryngology into, or working towards distilling it all into 100 topics that, like you all said before, be a jumping off point for resident education and trainee education.
It's an exciting collaboration, the development of this OCC curriculum. And the content is being developed by our education committees. There's 9 education committees, 8 are topic focused, and 1 is a simulation education committee with about 250 to 300 volunteer physician members that are passionate about otolaryngology education. And it's those committees that are responsible for developing the content of these modules. But what's unique about this program compared to many other of the educational programs that the Academy has been involved with in the past is that this one has oversight from an editorial board of program directors that are organized from the Otolaryngology Program Directors Organization, OPTO. And there's a group, as Sonya mentioned, of 16 editors of this, or members of the editorial board, 2 members of each of 8 specialties that are overseeing or editing the content that's created by our education committees, the Academy's education committees. So if you will, they're really peer-reviewed modules, and they're being peer-reviewed by program directors that are experts in otolaryngology training and resident education. So we'll be able to have podcasts and annotated surgical video procedures. There'll be webinars as part of it. I would expect that we would be able to have case-based learning and cases of the week or some sort of a product like that, and guided discussions of topics. So things that residents will be able to use besides just reading articles, which will be also part of it, and answering questions.
I think one of the really important key points of the curriculum, as well as what you said before about really embracing the adult learning principles. When it comes to the curriculum, it's not just sitting reading a textbook or listening to a lecture. We're going to have all these different modalities involved. And so I think the other nice thing is that for different learner type, there'll be something for everybody.
Another thing I wanted to mention, that a lot of residents like to learn on their mobile devices and in small pockets of time. They may spend 15 or 20 minutes in between cases or on their way home. They like to use the mobile device. By the way, practicing otolaryngologists also, there's a trend towards using mobile devices, and this curriculum will be available on part of the mobile platform as well.
So some examples of things that you might see in the first iteration of this, the first 25, are deep neck space infections, chronic rhinosinusitis with polyps, Meniere's disease, scar revision, rhinoplasty, adenotonsillar disease, and then we'll have some fundamentals, things like perioperative management and professionalism as well. And we're trying to, when these come out in 25, aliquot is to sort of have a spectrum of topics that are going to cover all the subspecialties within otolaryngology. So we're not going to focus all of our efforts on laryngology and facial plastics, but sort of have a mixture of all of these as we move forward.